Hello everyone, I am Dr. Priyank Suhag, Specialist OBGYN from CK Birla Hospital, Delhi. Today we are going to discuss certain common breastfeeding challenges and potential solution. Breastfeeding is a natural and a beneficial way to nourish your baby, but it can come with certain challenges. So the first challenge that the mother faces is a latch issue. The challenge is difficulty getting a good latch. So the solution is you have to seek help from a lactation consultant to assess and improve the latch. Ensure that your baby's mouth covers both the areola and the nipple. The second most common challenge is the sore nipple, the pain in the soreness in the nipple area. So you have to ensure a correct latch, apply lanolin cream on your breast or milk to soothe the sore nipples. If the breast pain or the soreness persists, you have to consult the healthcare provider. The third most common challenge is a low milk supply, and the concerns about not producing enough milk for a first time mother is a very challenging thing. The solution for this is you have to nurse frequently to stimulate the milk production, stay well hydrated, eat a balanced diet, and also consult a lactational consultant or a healthcare provider for further guidance. One most common challenge is the engorgement of breast, the breast feeling overly full or uncomfortable. The solution for which is you have to nurse regularly to relieve the engorgement. You can also use warm compresses or express a small amount of milk before feeding or to soften the breast. The fifth most common challenge is the plug duct, which you can feel as a painful lump in the breast. The solution for which is you have to continue nursing from the affected breast, apply warm compresses, massage the area, and ensure that you are using a proper bra support and rest. Sixth most common challenge is the mastitis, which we usually diagnose with fever or a flu-like symptom and a red painful breast. The solution for which is you have to contact a healthcare provider immediately. Antibiotics may be started and you have to continue breastfeeding to clear the infection. Nipple confusion is also one of the challenge. The baby struggles to switch between the breastfeeding and the bottle feeding. So you have to introduce bottle feeding after breastfeeding is well established, usually after 4 to 6 weeks. Use a slow flow nipple and a paced bottle feeding. Sometimes breast refusal is also a challenge. The baby refuses to breastfeed. So you have to try skin to skin contact first, different feeding positions, offering the breast whenever the baby is calm and not extremely hungry. Sometimes work, time or certain constraints are very much a challenge for balancing breastfeeding with work or a busy schedule. For this, the most important solution is to pump breast milk and to store it for later feedings. Use a breast pump that suits your needs and create a pumping schedule. Weaning itself is a greater challenge. Transitioning from breastfeeding to solid and reducing the breastfeeding is often not an easy way out. So you have to gradually introduce solids and reduce the breastfeeding sessions over time. Be patient and responsive to your baby cues. Remember that every breastfeeding journey is unique and it's okay to seek help and support from a healthcare professional, especially the lactation consultants. There are certain support groups also available. If you can encounter certain challenges, they will help you out. Don't hesitate to reach out for assistance whenever you are unsure of breastfeeding, and to maintain a successful breastfeeding experience, it is very essential that you take help from the healthcare provider for both you and for your baby health. Thank you.